First, though, let's turn to some health headlines. Joining us is professor at Northwestern University Medical School and WGN Morning News medical contributor, Dr. Lauren Streicher. Thanks for being here again.
Good morning.
All right, let's start with a new study about whether the amount of time you exercise is more important than the number of steps that you do.
Yeah, so this is interesting because we know that there's a very specific recommendation that is going to decrease your risk of heart disease, and that's to get 150 minutes a week in terms of moderate to vigorous exercise. And that's fine for people that are out there exercising and kind of keeping track of that time. But let's face it, the majority of people are not doing that. But they are keeping track of their steps because it's a whole lot easier to do. But there's never really been a equivalency. You know, how many steps do you need to get that same reduction in heart disease? So what they did was they took a large group of people, we're talking 14,000 people, they tracked their steps over a week, and then they followed them for the next 9-10 years. And they started with people who were over the age of 60, all women in this study. And what they found is that, yes, if you walk enough, that is the equivalent of doing that moderate to vigorous activity. The magic number seems to be around 5,000.
A week?
About 5,000 a day.
Oh.
5,000 steps a day, Robin.
That's a lot.
Yeah. But it's a lot less than the 10,000 that people think you need, which was just an arbitrary number that was based on marketing for some pedometer company.
That seemed really
right.
high.
So 5,000 is kind of the target. Obviously, the more you walk, the better.
How many steps in a mile, Larry?
How many steps in? Well, it's probably
5,000,
5,000, 6,000 steps. I mean, you take in, well,
In a mile?
depends on how tall you are.
I'll get on that. That's
Well, that's actually one of the big variables. I mean, there's long steps and there's short steps, but it gives you a target, something to go for.
There's a new method to predict if dementia will develop.
This is really important because when people get dementia, usually by the point they've been diagnosed, they're already symptomatic. And quite frankly, there's brain changes that start years and years before someone actually gets symptoms. So in this study, they took 1,000 people and they did something called a functional MRI. And an MRI is basically an MRI way of imaging the brain that looks at connectivity patterns in specific areas of the brain, basically how well those areas of the brain are functioning. And what they found is that with like 80% accuracy, they could figure out up to 9 years in advance who is destined to get Alzheimer's down the road. And why do we care? I mean, you think, do I really want to know?
Yeah.
You do want to know because now there's development of a lot of drugs that are targeting amyloid, which is what's accumulating in people that have Alzheimer's. And the sooner you can get someone on these drugs, the more likely it is to actually do some real good to prevent progression. So probably not covered by insurance yet, probably not something available yet, but it's really good to know that they're working on it.
And tattoos may increase your risk of cancer?
Yeah, okay. 1 out of 3 Americans now have a tattoo. 1 out of 3. And my entire family knows. I mean, I am not a big fan of tattoos, especially aging tattoos. And 1 out of 4 people have regret, just saying. But there have been no long-term studies about is there a health risk to having tattoos. So in this study, they followed 12,000 people, those with tattoos and those without, over a period of time, and what they found is that there was an association of lymphoma, specifically a 20% increased risk of lymphoma in people that had tattoos. Now, what was surprising and unexpected is it didn't matter if you just had one teeny tiny little, tattoo or if you're covered from head to toe. The risk appeared to be the same. Now, in fairness, there are other studies which show that there's no association, but I thought this was worth mentioning. I mean, there is a rationale behind it. The rationale is that the ink particles actually travel through the blood, get lodged in the lymph nodes, which is why with over long-term inflammation, there's an increased risk of cancer. So I'm just throwing that out there if you need one more reason to convince those around you that maybe a tattoo is not the best idea beyond the regret factor and the wrinkly aging tattoo.
All
right, fake versus compounded Ozempic.
Yeah, I mean, look, everyone's trying to get out there and get their Ozempic and Wegovy and some, their version of semaglutide. And not only are there shortages, but if your insurance doesn't cover it, you're looking at upwards of $1,200, $1,300 a month, which of course nobody can afford. So no surprise, there's been a lot of counterfeit semaglutides popping up, but there's also compounded. And they're not the same thing, and people need to know the difference. Counterfeit is basically fake. you don't know what's in it. It could be no semaglutide. It could be something different. It could be contaminants,
Yeah.
fake needles. And if you think you might have a fake semaglutide, you can go online and look at things like at the packaging. There's usually all kinds of grammatical errors and all that kind of stuff. But this is not the same as compounded. Compounded is legitimate. Compounded are pharmacies that make basically copies of commercial drugs or drugs that are not available, which are the same. But again, buyer beware, because there's compounders and there's compounders. And the good regulated compounders, you're basically going to get the same thing. But one of these compounders that's not regulated, sometimes they're using the salt of semaglutide. It's not regulated. You might not be getting the same amount.
Well, how do you know you're getting a compound?
but
Is it under the same name?
No, usually
Oh.
compounded will say compounded semaglutide
Got it.
as opposed to Wegovy, that it's going to be like fake Wegovy.
Gotcha.
So, but what we're looking at is with a legitimate compounded semaglutide, you can get them for $200-300 a month as opposed to $1,300.
And they're safe.
And they're safe. I mean, you want
Okay.
to go someplace that's trusted. I mean, MIDI
Yeah.
is the telehealth company that I work with, and they have a compounded semaglutide that's under $300 a month, and boy, is it regulated.
Is
You
that,
know exactly what you're getting.
in the yellow pages under compounder? I mean, do you go to Walgreens? Where do you?
Actually, Walgreens does compound, but they're not going to compound semaglutide. Compounding is legitimate, but yes,
Yeah.
you can look up and see, are they regulated? Look under FDA rules and regulations for
You
compounded
still need a
pharmacies.
prescription for it.
You still need
Okay.
a prescription.
All right.
Yeah.
Check out Dr. Stryker's Inside Information podcast, Menopause, Midlife, and more. Thanks again for being here.
Thank you.
Thank you.
Hey, Mike.